another article today from Zero Hedge. Pfizer mRNA influenza vaccine failed in clinical trial among senior FDA commissioners. By Tyler Durden King. Pfizer's experimental influenza vaccine will not be receiving approval absent new data proving that it protects seniors against the worst flu. The Commissioner of the Food and Drug Administration suggested in a new interview. The trial showed zero benefit. We're not just going to rubber stamp new products that work, that fail in a clinical trial. It makes a mockery of science. And if we're just doing a rubber stamp on things with no data, isn't that how everything's done? Okay, well, Pfizer's media team did not respond to a request for comment. Shocker. The experimental mRNA shot performed better in a trial than the already approved vaccine from different company among healthy people aged 18 to 64. Researchers with Pfizer and other organizations said in a recent paper published by the New England Journal of Medicine, NEJM. Sorry. The researchers did not mention that among vaccinated seniors or people over age 65 and older in the same trial, 0.5%, half of 1%, suffered influenza-like illness and had laboratory-confirmed influenza cases. And that was the same percentage as the recipients of the licensed vaccine. Many more seniors, 68.7%, reported adverse reactions within 7 days of the Pfizer vaccination compared to just 25% of the recipients that received the existing vaccine. All right, so 2.5 times more adverse reactions. But still 25% for the existing one. That's insane. 25%, should be like water. Nothing. The results from the seniors in the trial were posted to clinicaltrials.gov earlier this year and highlighted following publications of the paper by independent journalists and members of the panel that advises the Center for Disease Control and Prevention on vaccines, including Recep Levi, a professor at the Massachusetts Institute of Technology, MIT. I find this to be a major integrity failure in the peer review process, which has been a long-standing complaint about this peer review, which is just a bunch of friends saying, oh, yeah, that was a good article. That was good. Oh, yeah. I have an article I'm writing. Could you read it? Could you read my article too? Give me a peer review and we'll give each other peer reviews. Yeah, we'll help each other. We'll help no humans, but we'll help each other. Okay. That's what peer review is. The study authors are best able to answer your question. Spoken from the journalist at Epoch Time in an email when asked why the results of the seniors did not include in the paper. Okay, so Epoch Time, I guess, did an article without actual results. The study's corresponding author, who works for Pfizer, did not return an inquiry. Macquarie's comments came after Vinay Prasad, who heads FDA's Center for Biologics Evaluation and Research, wrote in a memorandum that officials will be revising the current framework for influenza vaccines, which he called an evidence-based catastrophe of low-quality evidence, poor surrogate assays, and uncertain vaccine effectiveness measured in case-control studies with poor methods. He indicated that more details would be forthcoming in internal conversations. So, people are just making up numbers. They are smoking the books, cooking the books, they are boiling the books, they are broiling the books, they're shish kebabbing books, they, all the things. Cooked books, burgers, everything. The current framework features annual approvals of updated shots and target strains projected to circulate. Scientists are actually psychics. They're psychics. They're mediums. Future strains. Based on shitty evidence. They just said. So they're just being psychic. Or wishful thinking. Or wishing for money. The FDA says on its website that the page updated in 2024 that the FDA approved flu vaccines are safe and effective. Officials with the Center of Disease Control and Prevention estimate that the vaccine's effectiveness against influenza since 2009 have ranged from 19 to 60%. Terrible. Prasad also said that for the most new vaccines, officials will be required randomized trials that provide evidence of efficacy based on clinical endpoints, which include prevention of disease. Dr. Robert Malone, angel from heaven, who leads the CDC Advisory Panel Influenza Work Group, told Epoch Times that the memo means the entire influenza vaccine annual vaccination enterprise is now subject to major disruption. Good. It is required for children in preschools to have the influenza shot. They have to have it up until they're 5. It's not needed in public schools. Well, not in New Jersey. Or not required. I don't think it's needed at all. But, I mean, you're injecting babies with these influenza shots. They don't even work. What are you doing? You're putting chemicals directly under the skin, not in the mouth where at least your stomach can, kill some of it with the acids. Or you could pass it, hopefully, and it doesn't get absorbed. We're doing a horrible thing to all the humans, and it has to stop, and hopefully it will.